And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, hello and welcome to Boomer Life here on CIL 650. I'm Sterling Fox, and this episode is all about hearing. And it's always a pleasure to welcome Dr. Ted Venema to the program. Dr. Ted is an audiologist and here representing the good folks at NextGen and Mainland Hearing Centers across British Columbia. Nice to see you again, Dr. Ted.
Yeah, good to see you again, too.
Well, we got a lot to talk about this hour, but first you have to tell us a story. Dr. Ted is one of the better storytellers who visits us regularly on Boomer Life, and I love listening to this guy's stories. And he's just an interesting dude who has just returned from an audiology convention in, of all places, Turkey, where you were invited to speak to a group of audiologists from the Middle East, mostly Iran. So how on earth, you were invited by a Canadian hearing company, hearing aid company.
Yeah, that's right.
And what was the name of that company?
That's Unitron.
And you used to work for them.
I did so. Yes, I did.
Okay, so you've maintained some kind of relationship with these guys over the years. So,
and when they sent me to Turkey, they told me, Ted, you'll fit right in.
I would have expected them to say nothing less.
Oh, yeah, of course.
So now when you go over, you fly half a world away to speak to, in this case, these are your peers. These are audiologists like yourself.
From Tehran.
Right. So, and this I would imagine they don't get out much, and I don't mean to say that, and they probably just don't.
Well, and they have, I guess apparently to go to Turkey, the Iranians need no visa.
Aha.
So they like to head over there as a vacation spot.
Okay.
Now, mind you, I've heard in Iran there's an area called Shiraz, which is really quite interesting as well. It's like our Okanagan, kind of pretty.
Oh, okay.
At any rate, this was a group of 30 Iranian audiologists who had schooled at the University of Tehran, and they offer bachelor's, master's, and PhD degrees over there and stuff like that. But they had come for a conference held and hosted by Unitron, this hearing aid company I used to work for.
Right. So now you would just you would be the dashing figure from the West, where I would assume relative to Iran, there are more cutting-edge technologies at play, more people doing investigations on a broader scale, better research into hearing and all of those issues. So what did these professionals, again, these are audiologists like you. So when you travel a half a world away and sit down with a group of pros like you, what do they want to know?
Well, I often present at conferences in Canada and United States too, like state and provincial conferences, and those are, populated by audiologists or hearing instrument practitioners as well.
Okay.
And I often deliver topics that they know about, but they want to learn more about.
Okay.
Like, topics on tinnitus, ringing in the ears, or topics on certain anatomy or physiology questions about the ear, or certain new developments in hearing aid technology.
Okay, sure. And that, I imagine, was a particular interest to them, right?
Yeah. So my talk over there was focused, it was called Common Clinical Encounters. Do we really know them? And it was touched on all these aspects of testing hearing. And, they've all done these things, and they have all known about them, but I always uncapped a certain issue about them, saying, well, do you really know why that test turns out the way it does? Here's a bit of an inside scoop, something interesting. So I'm not here to tell you something brand new, but here to just get you to look at something in a little bit of a different way. And then my 3-hour talk was followed by more product-specific talk from Unitron representatives themselves. Unitron is one of 7 hearing aid manufacturers, and it's Canada's only homegrown hearing aid company
I didn't know that.
Out of Kitchener, Ontario.
Okay, all right.
And by the way, that's kind of the Mecca or the Jerusalem of hearing aid companies, and is Kitchener, Cambridge.
Interesting.
Ontario for some reason.
Kitchener, Waterloo, the home of the BlackBerry is also the home of the hearing technology industry. So now these guys, would a hearing test performed by one of these audiologists who just listened to you speak last week, would a hearing test at an audiologist's place in Tehran be quite similar to a hearing test anywhere in BC?
Quite. All right. Quite. Yes, quite.
Okay.
They haven't quite split off from us yet.
Okay. So no, the procedure is basically the same.
They will do quite the same. In fact, their whole training is quite similar, and they're quite proud of it. They do have quite a good school in audiology. I've had some students in Canada who are from Iran, and they were trained at University of Tehran, and they knew their stuff. They're pretty good.
Interesting.
And they do a hearing test is a hearing test is a hearing test. You know, it's just done in another language.
Exactly.
And the hearing aid products, however, okay, they're going to be buying them from Europe or you know, subsidiaries of the hearing aid companies
Closer to home.
Yeah,
Right.
I mean, some of the main hearing aid companies are placed in Denmark. There's 2 out of Denmark. There's 1 in Switzerland. You know, and then there's a few American ones.
So can a Canadian person who goes to a next-gen or a mainland hearing center and has the test and discovers to his or her chagrin that perhaps a little technical assistance would be required here, can that Canadian client, Dr. Ted, order a hearing aid from anywhere in the world?
Yep. Here, of those hearing aid manufacturers, there's about 7, like I was saying.
Okay.
Some are European-based, some are United States-based. All of them have subsidiaries.
Okay.
So Canada will have a subsidiary office of each of those 7 manufacturers.
Okay.
And of course, it has its own hearing aid company itself, and that is Unitron. But Unitron has an American subsidiary,
a European.
Dutch,
right. Okay.
So you know, the hearing aids dispensed from next-gen mainland hearing will be from all sorts of manufacturers.
Okay. A couple of questions based on the stuff you've already told us. I want to go back to the hearing instrument practitioner versus audiologist, those designations in a minute. But you also said that in one of the questions in the Q&A session you did after your speech in Turkey, that people wanted to know, they were asking about ringing in the ears.
Yeah, that was one of them.
And you described that as tinnitus. Well, ringing in the ears was on Jeopardy the other day. And I got it because I do Boomer Life, and I know Dr. Ted. I got the right answer. I nailed it, except the guy on Jeopardy who got it and got it right called it tinnitus.
Well,
so
tomato.
So is that like a European-Canadian pronunciation versus an American pronunciation?
Not really. Some people call it tinnitus. I think itis sounds like an infection.
It does, rather, doesn't it?
To be technical, itis is I-T-I-S, whereas tinnitus, the last 4 letters are I-T-U-S.
Oh, okay.
So there's really no real rule. I call it tinnitus.
Okay.
If you called it tinnitus,
either way,
whatever.
Alex would have given us both a point.
There you go.
Okay. Now, let's talk about these designations. Now, first of all, let's start with yourself. You're a PhD audiologist. Obviously, to get there, you have to have a master's and a bachelor's undergraduate degree. At what point did you discover in your academic career that audiology was where you wanted to go? And after that, how many more years did you have to put in to get the designation you now enjoy?
Well, I studied. My bachelor's was from a college in Michigan, Calvin College, and I studied philosophy, ancient Greek. Had nothing to do with this stuff at all. Worked for a lot of years at Stelco Steel, landscaping, juvenile detention center in Calgary.
Okay.
And then decided I'd become a speech pathologist.
Oh, okay.
A speech therapist.
Yeah.
My girlfriend and I were walking up Hastings Street, and she came up with this idea. You're kind of a yacker. Why don't you try that? Become a speech therapist. I thought, cool. So I went to school in Bellingham, Washington.
Western Washington University.
Yep. And I got a master's.
Okay.
But I was studying speech pathology, and halfway through I thought, I think I prefer audiology, the hearing side.
Okay.
Because speech therapy or speech pathology and audiology are both in what's called communication disorders.
All right.
And you get your master's in one or the other.
Okay.
And so partway through speech, I decided, I think I like the hearing better.
Okay.
I'd never heard of audiology before. Only once I was in school.
Well, and I'd never heard of audiology until I started Boomer Life and our hearing shows with you.
Yeah,
so, you know, we're all kind of in the same boat here. We're all learning as we go along.
I call it audiology, O-D-D-I-O-L-O-G-Y. Sometimes it's pretty odd.
I appreciate the spelling variables, too. So then you got a master's degree in audiology as opposed to speech pathology.
And then I worked as a clinician for a few years in Toronto at the Canadian Hearing Society.
Okay.
And then after 3 years, I said to myself, I think I can teach this stuff. I'd like to become a prof.
Okay.
I think I'm going to go back to school and get a PhD. Now, that and a nickel will get you a cup of coffee. But these days, that and $1.50. But I studied at the University of Oklahoma. And
home of the Sooners.
Ever since, I've lost my accent, though. Ever since we moved up here.
Great football.
Yeah, they do.
And so at that point, a PhD in audiology?
In audiology. But,
okay.
Yeah.
So now, is that because you graduated from the University of Oklahoma,
Mm-hmm.
does your audiology designation, is it different because of if you had graduated from maybe UBC or the University of Toronto?
Well, that's a good question you're asking, Sterling, because in Canada, the audiologist needs a master's degree.
Okay.
And to get a master's, you go to school for 2 to 3 years after your bachelor's
Right,
degree.
yeah.
And then you get a master's. And that's the way it was in the United States, too. But about 10, 15 years ago, they changed it. And instead of getting a master's after the bachelor's, they made a 4-year clinical doctorate called the AUD, the OD.
Okay.
Just like an optometrist has a 4-year doctorate from University of Waterloo.
Okay.
You know, or a dentist, a DDS. He or she went to school for 4 years after their bachelor's degree.
Right.
An MD, same thing, a medical doctor. He or she goes to school for 4 years after a bachelor's degree. So audiology wanted to put itself into a doctoring profession, in quotes.
Okay.
So the American audiologist always has an AUD. The Canadian still goes by the old way of the master's degree, but both of them do the same thing.
Okay. Now, when you become an audiologist, as you would, for example, a medical doctor, is there a period of residency or internship that's required?
Yep. Yep. To get the AUD, I believe it's almost a year-long clinical practicum at the end. It's your 4th year.
Okay.
And that is not built into the master's degree. So some Canadians with a master's degree in audiology, some of them elect and say, I think I want to upgrade to the AUD because I'd like to call myself
an audiologist.
Yeah, I'd like to.
And so they have to go to the States for that
they
upgrade
do.
then, don't they?
They do. And some of them can earn, if they've got 5 years of clinical experience, they are entitled to earn it online. And they can't, some universities offer the AUD online as a bridge so that the remaining master's degree Americans who had masters as well could upgrade and get this AUD.
Okay, so now here in Canada, let's just bring the whole conversation north of the 49th here.
Yeah.
You are a PhD audiologist. So
that's different.
Right. So there are 3 designations that I'm trying to figure out here.
Sure,
Okay?
let's do that.
One is the high end, the medical sort of I guess superior in this category would be the ear, nose, and throat surgeon.
Yeah.
Correct?
Yeah. That
followed by the audiologist,
which is a university trained, just like an optometrist. You can think of the ear, nose, and throat doctor like an ophthalmologist.
Okay. So we're doing the eye-ear comparison here.
Let's do that.
That's a good idea.
Because then that we can kind of, and then the audiologist has a master's degree. The optometrist has a 4-year clinical doctorate, just like the American AUD did.
Right.
But
Sure.
both are similar in that they don't do surgery.
Right.
Okay?
Right.
It's like the difference between a psychiatrist and a psychologist. You know, a psychiatrist is an MD. A psychologist is a PhD.
Right.
They both do similar things.
Right.
But at any rate, the medical doctor specializes in surgery.
Right,
okay?
exactly.
The surgeon, he or she does surgery on the ear. An audiologist does not. But a surgeon can't fit hearing aids.
Oh.
A surgeon doesn't know diddly about hearing aids.
Okay, so now there's a third designation,
Yes.
and I suppose it's at the bottom of the ladder of 3, but it still sounds like a pretty important job, and that would be the hearing instrument practitioner.
Yes, that person has a 2-year college diploma.
Okay.
And you know what? They've got more common sense than I ever have, and that's why I never like to put them on a totem pole.
Right, I
I'd
know.
rather put them like on a triangle of 3. They work together like a team.
I know, and it was my unfortunate decision
No
to
worries.
rank them
Hey,
in numerical order.
Hey,
but
hey.
you know, we do that. We organize ourselves that way.
I know.
And but I think it's a really smart idea because we all know about eyes.
Yeah.
We don't pay half as much attention to
don't.
our ears and our hearing as we do to our eyes.
Yeah.
But in the eye world, the ophthalmologist is the eye surgeon.
Correct.
The optometrist is the professional who fits you and tests you and gets you your glasses.
That's correct.
And then
The optician.
the optician
is a 2-year college diploma graduate, and that person usually fills a prescription
right.
from the ophthalmologist or the optometrist, both of who can prescribe glasses. The hearing instrument practitioner is a little bit different from the optician, though. He or she also has a 2-year college diploma.
Right.
But in the hearing field, like the audiologist, the HIP, hearing instrument practitioner, can test hearing and prescribe hearing aids.
Oh, okay.
But the HIP is limited in scope of practice to adults.
Okay.
Whereas the audiologist can do the same for infants.
Ah.
There's a difference. A baby can't tell you what he or she hears.
Well, that's right. So the
you have to test them with brain waves and everything else.
I was going to say it
totally different kettle of
must
fish.
be a lot more sophisticated because of the inability to respond.
Right. So for the mainstream public, though,
yeah,
Joe Blow and you and I, you can be seen by an HIP or an audiologist, and both are equally, they're qualified in giving you a good hearing test and prescribing hearing aids.
Okay, now we need to take a break. Because Dwayne is having kittens already on the other side of the glass. And heck, we just got started. It's going to be a long hour here. Let's not give him too much grief. But just before we do, one thing that you have said to us many times, and this is where we're going to start when we come back. Okay. We don't pay as much attention to our hearing, certainly as we do to our vision.
We don't.
So here's a startling statistic from Dr. Ted, friends. The lag time between the time that a typical Canadian with some kind of hearing issue finds out about this deficiency in his or her hearing, the time between finding out and actually doing something, doing anything about it is 7 years.
Yeah, 5 to 7 years.
Are we foot draggers? Holy Moses.
Or what?
This is Boomer Life, and that startling statistic after that. We need to take a couple of minutes to digest that one. And we're back with Dr. Ted Venema from NextGen and mainland hearing centers across British Columbia right after this timeout.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.